Welcome to the Observe Day podcast, the show where we celebrate the days that matter. From holidays to meaningful observances, we bring you inspiring conversations, stories, and ideas to make each day count. Whether it's raising awareness, learning something new, or simply sparking joy, this is your space to explore the calendar in a whole new way. I'm your host, Wisdom Okonkwo, and I'm excited to share today's observance with you. Let's dive in. Welcome, Donovan.
Great to be here with you.
Yeah, for listeners meeting you for the first time, can you share a quick snapshot of your journey from health insurance insider to whistleblower and author?
Sure. So my name's Donovan Pyle. I'm the CEO and founder of Health Compass Consulting in Orlando, Florida. Health Compass is a management consulting firm that specializes in helping mid-sized businesses finance and procure healthcare more effectively so that they can meet their objectives. Beyond that, I'm the author of the forthcoming book called Fixing Healthcare: How Executives Can Save Their People, Their Business, and the Economy. And I'm also a senior advisor at the Validation Institute. So, yeah, to answer your question, the journey, has been kind of unpredictable. But I started off on the insurer side of the business when benefits brokers were my customers. And that led me down a very interesting path and really exposed a lot of the misaligned incentives in the industry that result in billions of dollars of waste each year in the United States.
Yeah, well, thank you so much for that quick snapshot. Since this is National Read a New Book Month, let's start with your book. What inspired you to write Fixing Healthcare?
Yeah, so really the thrust of the book was that, most businesses rely on benefits brokers to help them finance and procure healthcare more effectively. And they do that because, just like most of them don't have hard expertise in accounting or legal services, they don't have hard expertise in healthcare financing and procurement. So they rely on outside experts in this way. And so, but the problem is that benefits brokers work for insurance companies. And so what the book does is really shine a light on something that we call the broker blind spot, in that most employers don't realize that their broker gets paid by carriers and entities that are called pharmacy benefit managers. And they actually make more money when your costs go up, not down. And so, as you know, Wisdom, people are not very good at negotiating against their own self-interest and their own financial interests. And so this misalignment is really at the crux of why U.S. employers waste about $4,000 per employee per year on healthcare every year.
Yeah, and I know the answer I'm looking for, and I would the answer to the next question I'm about to ask is mixed in what you just said, but I just want you to pull it out from from the previous answer to the different question. And that is, at the end of the book, what do you hope listeners, I said listeners, why am I'm a podcast, I always keep saying listeners. What do you hope readers will walk away with after finishing it?
What do I hope readers do at the end of the book?
What do you hope readers will walk away with after finishing the book?
Yeah, so that's a great question. So, the thing that I hope they walk away with is clarity on the industry itself and how the industry and their healthcare supply chain actually works. Because right now, most executives, especially at mid-sized businesses, don't have clarity on who does what and why. There are all these different vendors throughout your supply chain and your health plan vendor stack. And if you don't know who does what and why and what their incentives are, it's really difficult. It's nearly impossible to make effective business decisions. And so I hope that, the book not only clarifies how this industry works, but I hope they actually start using and implementing the tools, frameworks, and strategies and methodologies that we put forth in the book. And the first one, which is really a prerequisite, a non-negotiable for your company's healthcare transformation, is getting unbiased advice. Get unbiased advice. Most employers work with legacy brokerage firms. They don't get unbiased advice. And you'll never get to the next steps in your company's healthcare transformation if you don't get unbiased advice. So that's the first step.
Yeah, the whole idea of this holiday is to encourage people to read something new. And for a lot of persons, when they hear the word healthcare, nah, that's not really for me, right? And I'm really glad that you broke down the whole idea of the book. But Just as a verbal confirmation, is the book just for healthcare nerds or enthusiasts, or is it for everyone?
So the book is I mean, in the United States, about half of our population, about 164 million Americans, get their healthcare benefits through their employer. Okay, so their employer makes a bunch of decisions each year on how they're going to finance and procure healthcare for the employees. And in the current state of things, 25% of what they're spending, $325 billion a year, is being wasted because they don't understand how to purchase these things. So while the book is absolutely really targeted for executives at mid-sized businesses, we're talking CEOs, CFOs, chief operating officers, human resource professionals. Since healthcare affects everyone, employees, I think, would glean something from this as well. And let's face it, I mean, healthcare continues to pull at one of the highest priorities as far as the conversation goes in the political landscape each year. And the reality is most Americans really don't have any idea how this industry works whatsoever.
Yeah.
So I think even the person who's not an executive at a mid-sized business will glean a lot from this book. And when they're having conversations with their friends over the kitchen counter, be able to have a much more constructive conversation because now you actually have a much better idea of how the system works.
Yeah. Wow. What was the most challenging part of writing the book?
The most challenging part of writing the book was really to narrow down on what the scope of the book is actually going to be. What are the core messages of the book? And what's really interesting is I think this is true in a lot of different areas of life, is that the process, there's so much value in the process, right? So going through that process of trying a bunch of different things honestly, I wrote maybe 4 or 5 chapters more than I needed to that ended up being taken out of the book very late into the process. But again, the process is what really helped me clarify what the core message of the book is. And but when you're going through it, you just don't know. You're wandering around in the darkness to some degree, and that's a little bit scary. And it's very tempting to feel like you're wasting time. But in reality, there's value in that process. So so I would if you're a first time author and you're going through it, just hang in there. Don't feel like you're just treading water. You're not. Even when you feel like you're just treading water, you're actually making gains. You're getting to your destination, even if at times it feels like you're taking a couple steps backwards.
Yeah. One of the things I noticed about your profile is whistleblower, and this book you're writing is the kind of book that I think will get industry pushback. Did you experience that?
Get some pushback from stakeholders.
Yeah. Yeah.
Well,
No, I
well,
mean,
yes. I
challenging
mean,
industry.
anytime you're exposing a misalignment that threatens some people's income, their revenue, sure. I mean, legacy stakeholders are inherently going to push back on this because this knowledge is going to potentially move the markets.
Before we dive deeper, I'd love to invite you to join the Observe Day newsletter. Every week, I send you highlights of upcoming observances, creative ways to celebrate, and behind-the-scenes extras from the shows. It's the perfect way to stay inspired and never miss a meaningful moment. Sign up today at observeday.com/join. That is observeday.com/join. Now, let's get back to the conversation.
And threaten some of their income and potentially force them to change and evolve. And I think that's a good thing. I think this is all a natural progression. When automobiles started becoming popular in the 1910s, I'm sure people that sold horses were pushing back against the automobile.
Yeah.
When typewriters were invented, I'm sure people that sold ink pens were pushing back against typewriters. So this is all just part of a market economy, and that's a good thing, right? I mean, Joseph Schumpeter taught us about the value of creative destruction, And it's all just part of the process inherently in a market economy. So challenging assumptions, challenging old ways of doing things is valuable. And let's face it, the United States, the healthcare system in the United States has only really been around for 80 or 90 years. The way we currently view
Yeah.
it, it's really not that old. It's not like these things are etched in stone. Someone just made it up. Someone
Yeah.
just made it up. And other people around today can say, you know what? Things have changed, and we don't have to keep doing it the old way. It doesn't serve us
Yeah.
anymore. It's just the world
Yeah.
has changed, and it's time to move on, and that's okay.
Yeah. Well, the National Reading New Book Month is one of the things is also about about discovering new perspectives, right? And that's the whole idea of reading a new book, right? What's one surprise? I know we kind of talked about the top level idea of the book and all that, but I just want you to zoom in on just one surprising truth from your book that
Mm.
will completely change how people think about healthcare costs.
Yeah, happy to do that. So, and again, this was a chapter that I wasn't even sure I should have included in the book. Um,
uh,
but it was really I ended up putting a chapter in on the history of how health insurance came to be. Right? What's the history? How did we even come up with these health insurance companies and these financial products that we know today?
yeah,
So just to give you the cliff notes on it, back in the 1910s and 1920s, um, you know, medical advancement started to come to the fore. Prior
okay,
to then, hospitals really weren't able to cure people for most of their ailments. Hospitals were essentially where the indigent went to go and be comforted in their last and final days. But in the 1910s and 1920s, there was a lot of inventions and medical advancements coming to the fore. And what that did was it started to increase the cost of the services that hospitals were providing, right? So their cost basis was going up. They were having to charge their patients more money. Health insurance didn't exist back then. In fact, in the year 1900, the average American spent more on cosmetics, on makeup, than they did on healthcare.
oh,
They spent about $5 a year on healthcare, about 1% of their income. And that's because, the demand for healthcare was very low because they couldn't actually cure most things. But,
yeah,
so as hospitals started to be able to cure things, their costs went up, and they started to have this problem where their patients couldn't actually afford their
yeah,
services. And so one day in 1929, some of the leadership at Baylor University Hospital in Dallas, Texas, had an idea. They said, what if we partnered with a large employer and had them prepay for our services, right? That would
yeah,
really help us stabilize our revenues, right? Instead of having this huge fluctuations in our revenues and not knowing who is going to be able to pay and yada yada, what if we had them prepay? So what they did is they partnered with the Dallas Teachers Union, right? I think they had about 5,000 employees, and they charged them 50 cents per employee per month. And for 50 cents per employee per month, these teachers could now go to Baylor University Hospital and have their babies in this nice, clean hospital. And
oh,
the program was a success. The teachers liked it, and the hospital really liked it because, again, it stabilized their revenue. And that was what became the first Blue Cross plan in the United States in 1934. They rebranded it as Blue Cross. Now, throughout that 5-year timeline, other hospitals around the country were taking note of the success that Baylor University was having with this prepaid revenue model. This was SaaS before there was SaaS, right? The idea of prepaying for
yeah,
services on a subscription basis. And so this is the really fascinating piece right here, is that by 1940, almost a dozen other hospitals put up the seed money to found their own Blue Cross plans, right? They actually put up the money to create health insurers.
oh,
Okay, so the reason that this is important is that, in today's environment, in the media, we always tend to think that hospitals and health insurers have this very antagonistic type relationship. They sit across from the table, and every 15 to 24 months, they have this kind of public fight in the media where, the other side, one side says the other side's being unreasonable in their, pricing negotiations, and vice versa. But at the end of the day, they are partners. Health insurance is simply a distribution partner for hospital services. They
Yeah.
are joined at the waist. And so, as an employer, you really need to know that both health insurance companies and hospitals benefit from rising healthcare prices, right? They benefit from those prices. Health insurers, in the employer market, whether you're self-funded or fully insured, benefit from rising prices. You have to understand that and why that is, and the regulatory environment that creates that. So understanding those incentives is hugely impactful, so that as an employer, you have some idea of what you're up against.
Yeah. Yeah. Wow. I think my surround saying when the use of a thing is not when the purpose of a thing is not known, abuse is inevitable. Yeah. So yeah, I like that. What chapter number is that? Just in case people would love to go get into more details of that story you just shared.
I
What
believe it's the
chapter?
second chapter. Yes, the first chapter basically outlines the challenge of the current state of things on how the average employer is overpaying by $4,000 per employee per year. And the second chapter dives into the history of how this industry came to be, and where it stands today, so that you have clarity.
Yeah. Well, you've taken a courageous step in um, speaking out against industry practices. And for me, I'm curious to know, how has being an author changed the way people respond to your message? Or did it not change anything?
Well, it's early days, Wisdom. The book is coming out. Actually, we just scheduled the launch date for. We're targeting November 4th of 2025,
Oh,
and
November. Okay.
it is interesting. There is a certain halo effect that I do experience from time to time, even though the book isn't even released yet. So yes, I think it does absolutely have an effect in the marketplace.
Wow. And on a final note, if you talked about healthcare and you talked about your book, and for listeners who are inspired to take action today, what's one thing they can do immediately to start fixing their healthcare benefits?
Yeah, so I would go to fixinghealthcare.com, and there's two things you can do. You can sign up
Okay.
for the wait list to get a free executive summary of the book, okay? And that will be released when it comes out. And if you're an employer listening, I would also take the quick benefits assessment that we have there on the website. And it only takes a few minutes, and it will show you how you are performing in the 7 categories of benefits value compared to your peers. And you'll get immediate feedback on how to improve your scores. And that's something that's very tangible.
Wow. Thank you so much, Donovan. Can you repeat the website URL again? Just
Sure, it's www.fixinghealthcare.com.
yeah. Well, I'll put the link in the show notes and description so listeners can just click and go directly to the site. Thank you so much, Donovan. And I'll be looking forward to the book in November. Yeah.
Great being with you, Wisdom.
That's it for today's episode of the Observe Day podcast. Thank you for spending your time with us as we explore today's observance. If you enjoyed this episode, be sure to subscribe wherever you listen to podcasts and share it with a friend who'd love to celebrate life's special days too. Don't forget to join the newsletter at observeday.com/join for more observance stories, tips, and updates. Until next time, keep finding meaning in every day.